I do have the doctor degree in the audiology and a PhD in audiology, and I know what I needed to know, and then I know about the audiology, and of course include the hearing aids. I do have a lot of experience because my first 10 years I was teaching and research, and then the second half of my career, for the past 12 years, I do have my own clinic. So I can combine the academic theory with the patient experience and make it all very practical for patient. Hearing loss tend to kind of like an invisible disease. No, most of the people doesn't know how suffering hearing impaired person experienced. And then also the hearing impaired person sometimes don't understand a whole lot of other things, signs, and the suffering, which is related with hearing loss. So I do spend time to do the patient education. There is one test that is aimed at to test people's hearing sensitivity, which includes like the air bone. I mean, because when we perceive the sound, it's not come from the air conduction, like from my mouth to my ear, that goes through the air as the media. That's called the air conduction. But at the same time, when I'm talking, my head skull also vibrate, and then that vibration and also deliver sound into my inner ear. That's called the bone conduction. So when the patient come in, if that is the hearing problem, I will do the hearing test. The test will test the type of the hearing loss, the degree of hearing loss, and also the speech perception ability. And after that, if patient like to try the hearing aids, then I will give the hearing aids consultation, which introduce all kinds of hearing aids and what is the pros and cons, and also give the financial aspect of the consultation. And then if the patient like to try it, then we can start to try it. And if patients decide to buy it, then after purchase, well, I still have the follow-up services, and that is the at least the 3 years, because all the hearing aids have 3 years warranty at least. And then also the services, afterwards services, is all free. The hearing aids for the past 4 or 5 years really progress a lot. For example, they have the all different kind of strategy to enhance speech perceptions. So in that case, patient can not only hear from the quiet environment, also from the background noise environment. Different companies have different strategy. When you are audiologist doing the orientation consultation, you should ask about this technology. And the other things is also, now the hearing aids, most of the hearing aids have the automatic program. That means that they have the automatic program for different environments. So for example, from the quiet environment, such as at home, and then go to the restaurant, from quiet to noisy environment, you don't have to push the button to change the program. And normally they have a 5, 6, or 7, or 8 different environment for automatic program. So in that case, that you change your environment, I mean, you go from one place to the other place. You don't have to change the, push the button to change the program in order to suitable for that environment. The other one is about the short communication technology, such as the Bluetooth technology. Now, most of the hearing aids has the Bluetooth, FM, and the near field technology built in. So patient can live like everybody else. So while you are driving, you can answer the phone without hand hold your cell phones. It can pair up to your hearing aid. And also the good things is both of your ear can hear about that. It can pair up with your iPad, your iPod, your computer, your television. So that case that you can hear very clearly. The other things is now a lot of companies offer the trial before buying. So Normally, by law, to buy a hearing aid, you can have 30 days trial period. If you do not like it, you are entitled to return it. And the company will charge a little bit amount to handle use the hearing aids. Normally, probably like 45, 50 bucks only. Each individual's type, degree of loss is different, and everybody's speech perception ability also different, and also each one's lifestyle also different. So we have to tailor the hearing aid fitting for each one with different one to fit their needs. Normally, I will ask a patient come to my place every 3 months, so I can do the clean, maintain for them. If they do follow the instruction, I do have a lot of people have the hearing aids last more than 10 years. I feel that I'm really enjoy to face my patient and solve their problem, let them enjoy their life, because that is mutual. I mean, they come to me, not only I have business here, but also if I help them, I feel that enrich my life.
When I was having conversations with people, particularly my wife, when she would start the conversation, I would always have to come back and say, "What?" And then I began to notice the frustrations on people's faces whenever I had to ask them to repeat what they were saying. And the other thing too, when I was watching TV or listening to the radio, I always had to have it turned up beyond what other people felt was comfortable. So most of the time I had to do with not hearing what was being shown or what was on the radio. And then on occasion, I still drive. I would not hear sirens or emergency vehicles. Many years ago, I was going to be a recreational pilot, so I had gone for a hearing exam, and during that exam they found that I had nerve damage in the ear. So when I asked what I could do, he said, "Well, really, there's not much you can do." And he said hearing aids would not be of any assistance. My daughter-in-law did some research and recommended Dr. Shaiu. So we came down, and she went through a very thorough test, and she pointed out to me that I had lost considerable portion of my hearing. So I was missing out on a lot of sound. So she recommended the hearing aids, which I currently have, and they improved my hearing more than 100%. And so I can hear very well, and I just don't realize why the doctor would say at the other time that hearing aids wouldn't be of assistance, because they certainly have been, and they're very comfortable, and I can hear very well. Much better than I could do way back then. She's very personable and very confident. And she goes beyond just my hearing problems, and she takes an interest in me as a whole person. So there's never any sense of rush or, let's get it over with and so forth. So I would highly recommend her for anybody with a similar problem.
When you listen to over the phone or watch the TV, you have additional devices that you could use that will help to improve the sound by a lot, and that is something that we should know about. According to Dr. Shaiu, this device is called a streamer, or Ustream. It could be used in connection with watching TV over the phone, or just use as listening device, which would improve the function of the device very much. Yeah, and that is something that we should be aware of, and the technology is still being improved upon, and every so often you have new things coming out, and it's something that you can take advantage of.
Before this, I was like in the speech program, and I was stuck there for a while because my hearing problem. I was like, I couldn't pronounce stuff properly, so they thought it was speech problem. So I was in speech for a while until like 8th grade when they did some hearing tests. I found out there was some bad hearing loss. Yeah, because with this I could hear that there are more stuff I could hear that I couldn't before, and things are clearer and I could understand stuff, and that also because before I'm like in the marching band, and it helps that again. It helps that just to keep the sound like I can actually hear the pitch and everything better and I can be within the band like a little better as a group. When I came here, like Dr. Shaiu gave me like a test and found that I have moderate hearing loss, and so I started wearing hearing aids, and I could see I improved my life a lot. Yeah, I like hearing aids that I got because with that I know I'm hearing better, and more stuff I could hear that I didn't before. Basically, I know we had some problem with insurance, and I know Dr. Shaiu took the time with us to help with the insurance to get the payment and everything, and I remember my sister said that she would help pay for the hearing aid because the insurance wouldn't. So I know Dr. Shaiu took a while, and that with us slowly until we finally got the funding from the insurance that we needed to get the hearing aid. Yeah, I recommend Dr. Shaiu to other people because she like I said, takes time with you, and if you have any problems with your hearing loss, she slowly goes up with you and makes sure that you get your whole potential that everybody else has in hearing. Yeah.
For a little period of time, I used to be around people and they were holding conversations, and it seemed like I always missed some of the conversations. So I was made aware. Someone said, maybe you need to go see an audiologist. So I made an appointment and I came here to WS, and Dr. Shaiu, she checked me out thoroughly through all the audiology machines and found out that I was soft of hearing in an area. And what happened was she told me that I would need a hearing aid. And what happened after that was I went home and talked with my family, and my son and I came down here. And she showed me the hearing aids, the different ones, and the technology that goes with the ones that I have. And it was it was wow, off the hook to me, you can have Bluetooth with it. You can hook it up to your TV, so you can be on a sound level where you don't have to have it all the way up the TV because it's hooked into your apparatus. And my hearing became much more visible and hearing. It was like everything you could hear. It was like, we have a couple dogs. And I never knew before this how much their footprints were around the house. Everything was accelerated. And I stuck with it. I am pleased with it. And I'm really more or less amazed at the technology, because a lot of people say now, especially some family members, you have to be careful what you say around him now because he can hear, And see, some of them were aware that I would miss certain things, but then all of them didn't tell me that, it was like they had a little secret. But once it was out in the open and I got the problem corrected, it's going along very, very well. And all I can say is that I'm very pleased with it. And the doctor is very attentive to your problems if you have any, and she will follow up and let you know how to get the most out of the equipment. And it really is something special to me, because especially when you get up in age, because I'm 81 now, and like I'm very, very happy. From my personal experience, I would recommend her to anyone I come in contact with who would need the service.